We're asking Governor Scott to protect and expand life-saving healthcare and housing policies that were implemented during the pandemic. Thousands in Vermont have benefited from Medicaid, the VT Emergency Rental Assistance Program, and the Emergency Housing Program during the pandemic. The public health emergency is currently scheduled to end in January, unless the governor acts. An estimated 30,000 Vermont residents will lose their Medicaid. Whether or not the Biden administration extends public health emergency precautions, we're calling on the governor to ensure that no one in Vermont loses healthcare or housing, and that the emergency measures are expanded so all Vermont can enjoy our human right to healthcare and housing.
Down to the governor's house, and I took back what he stole from me. Took back my dignity. Took back my humanity. I went down to the governor's house, and I took back what he stole from me. Took back my dignity. Took back my humanity. And now it's under my feet. Where? Under my feet. Where? Under my feet. Where? Under my feet. Ain't gonna let no system walk all over me.
He's calling up to the governor's office right now to see if we can speak to anybody there. We'll see what his answer is. Is there any way you could go up there directly?
Second security guard? Yeah, there you go. Yeah.
So he's talking to Marianne right now, seeing if we can get a staff person down here.
Who's Marianne? There is not a staff member here at the time, folks. You can leave those here and I will make sure he gets them, but he's not even in the office today.
Okay, thanks for checking. So
Yeah.
It seems like we can't speak to anybody in the governor's office. So we'll have to share our stories here.
I'm Zach Hughes, and I work part-time at Washington County Mental Health, and I've been on Medicaid for a long time, and I'm in project-based housing. I always have to calculate when I work too much or anything like that sometimes, and also I am calling on the governor and legislature to work on the homelessness issue, as I have for people out on the street, as I've had to send 2 people south because they had no other alternative but to go south, even though one of them had a full-time job. I'd like to close with, anyone can become homeless. It can happen to anyone. Thank you.
Well, my name is Zoe. I live in Plainfield and have been on Medicaid since I moved to Vermont 2 years ago. I work 2 part-time jobs, one of which doesn't offer any benefits, and the other would take over $300 a month out of my paycheck for health insurance. I already have over $100 a month of medical costs that insurance doesn't cover, and as someone who makes just over the Medicaid limit, I can't afford to lose it. Cheaper public market plans would also be expensive for me because they don't fully cover essential services like mental health and eye care, both of which I rely on daily. Why are these the options we're left with when hospital CEOs and insurance companies are swimming in money? You know what the right thing is, Governor Scott. Don't cut anyone off of Medicaid and instead expand it so that everyone in Vermont has free public health care.
My name is Griffin Shumway, and I'm going to be sharing a story by Skylar McGuire. I live in White River. My name is Skylar, and I live in Bristol. I work 2 part-time jobs and earn around $30K a year. My employer does not offer benefits. I've been suffering from debilitating anxiety attacks as the Medicaid cutoff approaches. My chronic health conditions are becoming worse from the stress of losing access to my doctors. All of this is happening because I work and will make too much for Medicaid despite living paycheck to paycheck. Losing my Medicaid will hinder my ability to climb out of poverty. There is no logic in this system, and I am traumatized from having to wonder what parts of my body I'll need to neglect to afford to live in this state, especially during times of high inflation and a housing crisis. Vermont Health Connect and their plans, including tax credits or subsidies, provide zero respite in actuality. It's time to put people over profits. Healthcare is a human right. Expand Medicaid.
Yep.
We're going to leave these petitions here with you.
Certainly.
Each one is a demand by the Governor Scott's constituents.
Certainly.
To stop this insanity and to put people first.
Stop the cuts. Healthcare for us all. the hospital, and I took back what they stole from me. I took back my dignity. I took back my humanity. I went down to the hospital, and I took back what they stole from me, and I took back my dignity. I took back my humanity, and now it's under my feet. Where? Under my feet. Where? Under my feet. It's under my feet. Ain't gonna let no system walk all over me.
Woo! We did it! Forward together!
Not one step back.
Forward together!
Not one step